Curious to get your thoughts on any kind of trends, new trends in GI that or technologies or therapies that you're introducing to patients.
Well, I think, one of the biggest ones we're seeing, not just in GI, but in other areas, is artificial intelligence.
Mm.
So, and just how we've been incorporating that into clinical practice has really been amazing to see, because we're just kind of at the forefront of it now and what it can
Yeah.
do. So that's
So
been
what's
something
that look
really
like? I've
cool.
not heard this before. So
Yeah, so one of the first things we're using it for in GI is just on colonoscopies with polyp detection. So we've got these systems now where as you're doing a colonoscopy, it'll kind of highlight a polyp or something. And so they've used all these thousands of videos to train this computer software to recognize polyps or mucosal abnormalities. And then as you're doing a colonoscopy, it helps you identify them. It kind of draws your eye to it. So it can help improve polyp detection rate and things like that. And I think in the future, it's also going to be utilized to see kind of other things like dysplastic lesions or something. So let's say, for instance, like inflammatory bowel disease, we do surveillance colonoscopies to look for these areas of mucosal abnormalities that are kind of headed towards cancer, but maybe they're very subtle or you can't see them well. And it's the same thing on an upper endoscopy. When you've had chronic reflux, sometimes you get what's called Barrett's esophagus, which is a change in the esophagus that can be a risk factor for esophageal cancer. And so I think they're also going to have some type of artificial intelligence that'll help us identify maybe problem areas in that mucosa that we should target biopsies and things like that. So that's one of the areas. There's another one. So for